In today's surgery, we are looking at a question for tracheostomy. So go straight to read the scenario question for today. The question says, Malama 16-year-old, a pupil of Manungu High School, is admitted to female surgical ward with severe dyspnea due to severe bends of the throat. She sustained the bends after taking corrosive liquid, wanting to commit suicide. She is scheduled for tracheostomy. Question A, define tracheostomy. Question B, state 5 indications for tracheostomy other than the one mentioned in the stem. Question C, discuss the post-operative care of Malama after the tracheostomy. Question D, state 5 complications that Malama may develop after performing tracheostomy on her. So we'll go straight to question A. We can define tracheostomy as this is a surgical procedure that involves creating a stoma in the anterior wall of the trachea and inserting a tracheostomy tube into it to help establish a secure and patent airway. So this is how we can define tracheostomy. The next question on the indications for tracheostomy. The first indication is, of course, prolonged mechanical ventilation. Tracheostomy can be performed on any client or individual who may need to be intubated for an extended period of maybe more than 7 or 14 days. Hence, the proper way would be to do tracheostomy rather than the other method where you push in the tube all the way to the lungs, because that can end up damaging the lungs in the long run. Head and neck surgery, this can be done especially for procedures that are involving the upper airway, and of course any procedure that is involving the head. So tracheostomy may be done just to promote good circulation of air and continuous breathing, and just to secure the airway during and after surgery. Trauma to the upper airway, this can be an indication for tracheostomy, especially where there is neck trauma resulting in maybe swelling or fracture or injury to the larynx or trachea itself. Tracheostomy may be done just to promote continuous breathing. In a bid to manage secretions properly, where there is high buildup of secretion in patients, tracheostomy may be done just to facilitate proper breathing and also just removal of secretions faster. Also, where a patient has major airway infections, it could be infections like epiglottitis or Ludwig's angina. All these are life-threatening upper airway conditions that may cause obstruction. Hence, tracheostomy can be done to secure the airway so that the patient can breathe effectively. The post-operative care that we can use as requested by question C. The outline, of course, you use this particular outline. Talk about the aims that you can use. Talk about patient collection. Talk about environment. From environment, talk about promoting a patent airway. From there, talk about promoting adequate breathing. From adequate breathing, talk about promoting adequate circulation as well. From there, you talk about care of the drainage tubes. From care of the drainage tubes, talk about observations. And from observations, talk about pain management. The patient will still be on pain because of the incisional site. Talk about psychological care. And from psychological care, talk about nutrition. From nutrition, wound care itself. Talk about exercise and the importance of exercise. Talk about hygiene. And finally, you talk about elimination. So this is the outline and the details that you can use as you talk about the post-operative care of the patient who has undergone tracheostomy. The last question was 5 complications that Malama may develop after performing tracheostomy on her. Amongst the complication, one of it is tubal obstruction, and this is basically a life-threatening emergence, and it is caused by where there is a thick, dried secretion that ends up blocking the airway itself, and the tube may even become displaced, and the tube may even touch or adhere to the tracheal wall itself. So this will cause a sudden respiratory distress and just severe difficulties passing a suction catheter into it because of the thick mucus. So tubal obstruction may occur as a complication in that particular manner. Bleeding as usual may occur just like in other post-operative complications where there's no proper healing or especially on the blood vessels on the site of the procedure. Infections may occur which may originate from the stoma itself, the incisional site, and of course subcutaneous emphysema may occur where the air leak into the soft tissue around the neck and the face, and this may cause a crackling sensation which is known as crepitus and swelling around these areas mentioned. Of course, other complications that may be seen is tracheostenosis. This is a long-term complication where scar tissue forms at the site of the stoma, and it causes the narrowing of the trachea itself. And when narrowing happens, it will cause stridors and breathing difficulties, which may require sometimes even further surgical interventions just to dilate the narrowed portion of the airway. So these are the complications that we can mention, and basically this is how we can attempt this question for tracheostomy. That's all for today. Till next time, goodbye.